Hello, friends of Summit and Grace Harbor County residents. I'm going to take a little bit of your time today, with your permission, to talk a little bit about COVID vaccinations. As you know, the FDA recently approved the first vaccine for COVID-19 produced by the company Pfizer. It's expected that they will review this week and probably approve the second vaccine by the company Moderna, and this will allow us to begin vaccinating individuals across the country against the COVID-19 virus. So I'm sure this raises many questions for you, and I've been asked several questions, so I thought I'd take the opportunity to address some of these questions for you. First of all, is the vaccine safe? And this is a very rapid development of a vaccine, and you might wonder, why was it accomplished in such a short amount of time? And really the answer to that is because of the urgency and the amount of money and resources that were committed to achieving the development of this vaccine. As part of that research, all drugs, including vaccines, go through several steps of trials or phases, typically a minimum of 3, at which these vaccines have both undergone those trials, and other vaccines that are still under development. As part of that, for example, the last phase 3 for Pfizer, there were approximately 43,000 individual subjects who volunteered to participate in that trial process. And we have the data that have been reported and collected from those individuals. In terms of safety, it seems to be very safe. There were, out of 43,000 individual subjects, there were no major side effects. The most common side effect that occurred was fatigue in 3.8% of patients and headache in 2% of patients. Is it effective? So we want the vaccine that's going to help prevent the spread of this infection, both to an individual who becomes vaccinated or immunized, as well as to the general public. And it looks like, based on the research and the results of the scientific studies, that both of these vaccines have a 95% effectiveness. What does that mean? In the study, Pfizer research of 43,000 individuals who received 2 immunizations, there were only 8 cases that developed COVID-19 infections. In the placebo or the study group, and that is individuals who did not receive the vaccine, there were 162 cases of COVID-19. So there's a significant reduction in the risk of contracting the disease and therefore spreading the disease. So we think the drug is very safe, and we think it's very effective, and these are significant criteria that the FDA and the CDC have to review in determining whether or not a drug or a vaccine will be approved for use. Is there cost related to the vaccine? So this is another common question that we get in terms of how much will it cost. And currently, the plan is that there will be no charge to an individual for receiving the vaccine. This does not mean that insurance or the government will not be charged for administering the vaccine, but right now we do not anticipate any copays or individual charges for receiving the vaccine. It's our country's intention that we have as many people vaccinated as possible, and this will quickly begin to control the spread of the infection. Unfortunately, there is a limited supply of the vaccine at this time. Now that it's been approved, Pfizer will begin mass producing the vaccine. Currently, there's an estimated 300,000 doses, and within 4 to 6 weeks, they estimate increasing this amount to 1.8 million. But there are a lot of Americans that need to be vaccinated. So the CDC, and in collaboration, the Washington State Department of Health, have adopted a phased approach to who is going to receive the vaccines. Currently, we will be in phase 1, and in phase 1, the most vulnerable, or if you would, the most important to vaccinate are healthcare workers first. The reason for this is not that they are less healthy, but that we need to protect our healthcare workers from getting the infection so that they can continue to work and care for those who may get the infection. Without that, our health system would really crumble, and we would be in a significant problem. So the first plan is to vaccinate those healthcare workers who are taking care of patients and or at risk, as well as our first responders. Then as more vaccine becomes available in the first phase will also be individuals who are at high risk, and those are elderly with comorbidities, and particularly people co-living in concentrated housing such as nursing homes, assisted living, and etc. Within 2 to 3 months, it's anticipated that significantly more vaccine will be produced, and then we'll move into phase 2, and this will broaden the individuals who are eligible to receive the vaccine. And then as we go through the year, vaccinating more and more people. As we do so, we should see the death rate decrease, and we should see the infection transmission rate decrease, and eventually, as more and more people become vaccinated, this infection will become under control. Currently, this is not a mandatory vaccine, but I want to encourage you all to consider the benefit not only to you as an individual in reducing your risk, but also our commitment to our community. So that if I become vaccinated, whether or not I had the infection and it would have made me seriously ill, it helps protect me from getting it and spreading it to another individual. This is called herd immunity. Without enough people vulnerable to get the infection cannot spread any longer and therefore will die out. So I strongly encourage you to consider getting the vaccine. There are a number of websites that you can look up to gather more information about the safety and the efficacy of the COVID vaccine, and I encourage you to look up those. You can do so at the CDC website for the COVID vaccine. Pfizer, that's Pfizer, has a good website to learn more about the COVID-19 vaccine, as well as Moderna, Moderna. In addition, our Washington State Department of Health has great resources for the COVID vaccine. Lastly, I just want to talk about Summit's role. Summit has applied and will be receiving vaccine as it becomes available. We do not yet know which vaccine we will receive or exactly when. We will be working under our Grace Harbor County Department of Health to learn which other organizations or institutions we may be asked to help facilitate their receiving of the vaccine, such as fire departments, police departments, or other entities. We will be contacting those individual organizations once we know exactly who they are and determining who is interested in receiving the vaccine so that we can put together the numbers that we'll need. Both of the vaccines have a limit in terms of the availability to administer the doses once these are open, and so there'll be some significant organization that has to occur so that we can maximize the dosing of the vaccines once they're available. This is an exciting time for us in America. We're hoping that this will be a significant change in our fight against the COVID virus and help us to reduce the loss of life, help us to get back to our a pre-COVID balance in terms of people availability to work and go out in the community. So again, I ask you to do your part, and here at Summit, I hope to be the first person to get vaccinated. Please feel free to contact us if you have any questions. Stay safe.